other kind that depends on the progesterone receptors available in the uterus and the amount of contraction in the uterus, which can be prevented by progesterone suppositories. The other thing that is related is infection, and most commonly what we call bacterial vaginosis, which is the presence of some what we call anaerobic microorganisms, and that can lead to preterm labor or premature rupture of membrane, which is a major problem. There are tests to check whether we are in actual labor or not, so we can prevent giving unnecessary treatment like drugs to stop the uterine contractions and steroids to help the lung to expand. Apart from that, I don't see major development in this area. I mean, we're trying our best, but preterm labor will still be there, will still happening, and at the same time we have to go hand in hand to prevent preterm labor and to try to improve the outcome of these babies, because as you probably know, about 50% of very preterm babies will die, and the other 50%, maybe half of them, will have mental disabilities or physical disabilities when they grow older. Sure.
Dr. Mohamed,
so it's quite important areas that we'll
As we're running out of time, I'd just like to ask you one quick final question. Tell us about some of the screening programs that should be undergone throughout the different stages of pregnancies to actually avoid congenital malformations and genetic disorders. I mean, what are the screening programs that any mother should go through throughout her different stages of pregnancy to detect these malformations and to treat them if possible?
Right, well, the word screening means that we have a simple cyst that we offer everyone to detect those at risk and offer them help. So, hello, can you hear me?
Go ahead.
Hello?
I can hear you, Dr. Mohamed. Go ahead.
Sure, sorry. So we start with the first screening ultrasound scan at about 11 to 13 plus 5 days, 13 weeks plus 5 days, which is called a combined testing. And in that test, we do a mini anatomy scan. We check the head, we check the brain, we check the presence of the nasal bone, we check the chest, the heart, the abdominal wall, the limbs, hands and feet, and then we check the back of the neck, the thickness of the skin of the back of the neck. And we do a blood test which will include some hormones in the blood, pregnancy hormones and proteins. And this will give you a risk factor of Down syndrome, and also can give you an idea if there is a major congenital anomaly that can be discovered at this stage. So that will give the patient the chance to decide what she wants to do next. After that, the next screening test, apart of course from the normal booking blood test that we do in pregnancy, we do a scan at 20-21 weeks to check for congenital abnormalities, and the scan can be more specific to check for more abnormalities or more subtle changes in the brain, in the heart, in the chest, in the kidneys, feet and hands, fingers, everything. Between these two occasions, between the first screening test at 12 weeks and the second test, we can offer amniocentesis or CVS, which is taking a sample from the blood, from the fluid around the baby or from the placenta, to check for abnormalities or chromosomal abnormalities or genetic abnormalities that we know about, and that depends on the result of the test that we've done already at 12 to 13 weeks. After that, there's not much screening tests after the scan. Some people might screen for the length of the cervix, which will prevent preterm labor again, and that's important. That's probably more important than the congenital anomalies itself,
and of course,
because of the major effect.
Sorry to cut you out, Dr. Mohamed, we're running out of time, but of course all these problems and complications can be avoided through visiting a neonatal clinic, as our guests here in the studio have also stressed. On this note, Dr. Mohamed Abdel-aal, I'd like to thank you for joining us. us. Dr. Mohamed is a consultant and obstetrician and gynaecologist at the Ealing Hospital and also the Portland Hospital of London. Thank you for joining us on today's edition of Medical Files.
Welcome.
Moving back to our guests in the studio, Dr. Abdul Hakim and Dr. Sameh, you are both members of the society, or the Neonatology Society here in Saudi Arabia. Tell us about the society. I mean, what does the society aim to do in the field of neonatology?
The society is a newly started organization. It's a non-profit organization that have been started from our annual meeting, actually.
Sure.
3 years back we gathered and we thought, you know, if we're going to do annual meeting for all the people interested in neonatology in the field, in the kingdom, why not to have one society as an umbrella for them? And indeed it happened, and it's recognized by the authorities in the Saudi Health Society, Health Mission. And usually, you know,